sperm in the egg occurs can vary somewhat, but ideally, the fertilized egg implants into the endometrium or the endometrial lining of the uterus and develops there as opposed to within the fallopian tubes, which is so-called ectopic pregnancy. Now, where the sperm and the egg meet exactly can vary, as I mentioned before, but in general, the faster swimming sperm and the more far along the ovulatory trajectory the egg are, the higher the probability of a successful fertilization because of the proximity to the implantation zone of the uterus. So basically, it's all a probabilities game. It's a probabilities game related to the number of sperm cells that encounter the egg and where the egg is in terms of its ovulatory cycle, and also its position where it is in the ovulatory cycle. The sperm parameters, I should say the semen parameters and ejaculate parameters that most clinicians want to see if you were to give a sperm sample would be somewhere in excess of 15 million sperm per milliliter of ejaculate. Now, there's a lot of discussion nowadays. It seems to be a very popular news theme to talk about diminishing sperm counts. You know, the idea that 100 years ago, or maybe even 35 years ago, the typical male ejaculate contained 100 million sperm per milliliter. And nowadays it's down to 15 to 20 or 50. And indeed, sperm counts do seem to be declining, and the exact reasons for that are not clear. Now, I confess I'm a little bit reluctant to talk about this because there have been a lot of back and forth discussions about the safety of EMFs, of electromagnetic fields. That's not exactly what we're talking about here, but there are some excellent data contained in meta-analyses and reviews that I will provide links to and that we'll talk about in more detail in a minute that correlate the advent of smartphones, and in particular carrying of smartphones in the pocket, with diminishing sperm counts, although there are certain to be other factors that can explain diminishing sperm counts as well. Dr. Shana Swan, for instance, has done beautiful work describing how the phthalates and the BPAs and so-called endocrine disruptors might be disrupting some of the milieu of the seminiferous tubules. So this would be reductions in testosterone and or disruptions to the Sertoli cells and androgen binding protein brought about by endocrine disruptors such as phthalates contained in pesticides and contained on printed receipts and things of that sort. There are some data that is negatively impacting sperm counts. How much so is still debatable. There are also quite good data pointing to the fact that both the heat-related and the non-heat-related impact of smartphones and laptops contained on the lap are impacting sperm counts in a negative way. Again, there's going to be tremendous variation in the concentration of sperm from one individual to the next. It will vary according to age and a number of other factors that we'll talk about a little bit later. But in general, if somebody is wishing to conceive, then clinicians like to see a ejaculate volume of more than 2 milliliters. So ejaculate volume can be anywhere from 1.5 to 5 milliliters, and that will strongly be determined by how frequent ejaculation is occurring. There's a lot that goes into evaluating the quality of ejaculate in sperm, but basically these huge variations that are observed of anywhere from 15 million sperm per milliliter, or in some males who are not producing sperm for whatever reason, we'll talk about those reasons in a little bit, as low as 5 million sperm per milliliter, all the way up to 100 or maybe even 200 million sperm per milliliter. Huge variation. The cause of which is not always clear, but is certainly determined in part by the frequency of ejaculation. So because there are so many variables impacting why one male versus another male, or even the same male across the lifespan, might have variations in his concentration of sperm within the ejaculate, let's talk for a second about frequency of ejaculation as it relates to the goal of fertility per se, because that's really what today's episode is all about. So what I'd like to talk about next is how people can increase the probability of a successful fertilization, focusing both on the components from the male side and from the female side. And I'm mainly going to couch this discussion in the context of the so-called natural method of sexual intercourse and ejaculation in vivo, right, within the female. But I will also touch on some parallel themes as it relates to in vitro fertilization and intrauterine insemination. Okay, so the idea here is that we want the maximum number of high-quality sperm, that is rapidly forward motile sperm that are of the correct morphology, that is shape, That's going to require a lot of mitochondria in the mid-region, a well-shaped head, so it's going to be an oval-shaped head. The tail is going to be a single tail, not multiple tails. These aren't going to be the twitcher type of or immotile type of sperm that are either twitching in place or aren't moving forward. All of those components are going to be essential for increasing the probability of fertilization. But of course, there's the female side of it too, which is that ovulation occurs on just one day during the menstrual ovulatory cycle, and that egg will be available for fertilization for approximately 24 hours. Now, keep in mind that the sperm can survive within the vaginal duct and within the area around the cervix and within the uterus and along the female reproductive tract for anywhere from 3 to 5, or it's even been described as up to 7 days, but generally it's going to be about 3 to 5 days. Now, most women can figure out the day of their ovulation by counting the total number of days of their typical cycle. And this is where it's really useful to have a cycle that's of more or less regular duration, or rather of more or less regular length. So as we talked about earlier, if somebody's cycle is 21 days or 25 days and it's 21 or 25 days consistently, or even 30 days consistently, that's going to be a far better scenario to favor fertilization than if it's 20 days 1 month and then 21 days the next month, but then suddenly, 30 days and then suddenly 35 days. Those varying durations of the ovulatory cycle make it very hard, obviously, to time and understand when ovulation is going to occur. So regular duration ovulatory cycles are the ideal circumstance. And they're the ideal circumstance because even though the egg is only available for fertilization for a few days, those sperm can survive for some period of time, which leads to the issue of how often should couples be having intercourse. And here I'm referring specifically to intercourse with ejaculation. How often should couples be having intercourse around the time of ovulation if the specific goal is successful fertilization of the egg and the creation of a baby? Okay, this is leaving aside all issues, which of course are interesting issues related to how often people are having intercourse, whether or not there's ejaculation every time they have intercourse or not, for sake of pleasure or for sake of pair bonding and pleasure, or for sake of any number of other potential goals of intercourse. Here, I'm only referring to intercourse as it relates to the goal of fertilization of the egg. Okay, so knowing what we know about spermatogenesis and the fact that ejaculate is going to contain a certain concentration of sperm, but that within that ejaculate, some of the sperm will be older and less healthy, and some will be optimally mature, and some might even be a little bit immature, although there's a tendency for the immature sperm to not have yet exited the seminiferous tubules, gone into the epididymis and vas deferens. But given that the ejaculate contains sperm of varying ages and therefore varying quality, and given that with each successive ejaculation in a short period of time, there's going to be a decrease in the concentration of sperm per milliliter of semen, of ejaculate, we can make some good arguments as to how often couples should have intercourse with ejaculation around the time of ovulation if the goal is to fertilize. If ovulation occurs on, for instance, day 14 of a cycle, and here we're using the kind of standard average of 28 days of the cycle, but for some people with a 30-day cycle, that could be day 15, or with a shorter cycle, it could be day 12, for instance. But given a 28-day average cycle, let's say ovulation occurs on day 13 or on day 14, and typically would occur on day 14 of a 28-day cycle. Well, then, given how long sperm can survive inside of the woman, you might think that the optimal strategy would be to have as much intercourse with ejaculation in the 3 or 4 days leading up to ovulation. Hope that those sperm have swum as far as they possibly can and will encounter the egg just as soon as possible after it ovulates. It turns out that's not the optimal strategy. The optimal strategy is really to maximize the concentration of healthy sperm within each ejaculate and to really center that around the day of ovulation. So what this involves generally, and what the typical recommendation is to abstain from intercourse with ejaculation about 2 or 3 days out from ovulation. And then on the day prior to ovulation and on the day of ovulation to essentially introduce as much semen and ejaculate into the reproductive pathway of the female as possible. Okay. Now, that's the general recommendation that the OBGYNs and the urologists that I spoke to gave, but you will also hear a different strategy. It's only slightly different, but the different strategy involves trying to maximize the concentration of healthy sperm within each ejaculate, with the understanding that with each subsequent ejaculation over about a 24-hour period, that there's going to be a dramatic